Hello, everyone. The United States is good at breaking records. Today and yesterday, we broke a not-so-sought-after record, and it technically, we were competing against ourselves for a personal best, one could say. But alas, the U.S. hits highest single day of new coronavirus cases with more than 45,500, breaking April record. The grim milestone reported Wednesday surpasses the peak hit in late April. The U.S. saw a record number of new coronavirus cases in a single day, with 45,557 diagnoses reported Wednesday, according to a tally by NBC News. Wednesday's cases topped the previous highest daily count from April 26th, during the first peak of the pandemic in the U.S., by more than 9,000 cases, according to NBC News' tracking data. The World Health Organization reported its single-day record on Sunday, with more than 183,000 new cases worldwide. Now, some of you may be thinking, Trups, I thought you said the U.S. was doing well. The coronavirus lockdowns were easing up and people were going back to society. Well, you were right. Those things are happening, but you may have noticed something happened in the U.S. not too long ago. Now, technically, what I'm about to say is not corroborated by any media organization, but I have a sneaking suspicion it's still valid. You remember those hundreds of major U.S. cities a couple weeks ago that spontaneously burst into flames at the same time as the largely peaceful Black Lives Matter protests were going on? For some reason, I think it had something to do with it, but fear not, you foolish conspiracy theorists, because NBC News is here to dash away all those thoughts. Black Lives Matter protests haven't led to COVID-19 spikes. It may be due to people staying home. As the protests grew, many people not participating opted to stay home and avoided going out. There is no evidence yet that the wave of Black Lives Matter protests across the U.S. sparked COVID-19 outbreaks in more than 3 weeks since they began, according to a study published Monday by the National Bureau of Economic Research. Rather, as the protests went on, people who were not participating increasingly stayed at home, possibly counteracting any effects the large gatherings may have had on the spread of the virus, the researchers concluded. There is no evidence yet. What kind of evidence would be needed to confirm these things? Perhaps an admission by some folks who took part to not only admit they took part in these protests, and also for them to have a positive coronavirus test result after willingly going to take a test. All those things is a way to test that, right? Well, how likely is that? Me thinks, not so much. Well, don't worry. I'm sure the CDC's contact tracers will ask those questions, right? Right? Oh. NYC's contact tracers have been told not to ask people if they've attended a protest. Oh. Officials who say they're contact tracing protesters hurt the fight against COVID-19. Medical professionals on the front lines of the coronavirus pandemic are not happy with the government officials who talk about contact tracing protesters. Not only are they concerned that protests, which have occurred in more than 350 U.S. cities, will lead to new clusters of COVID-19 outbreaks, they're also frustrated by how public officials are talking about those protests and worried it could hamper efforts to contain the coronavirus. Weird. I agree with the government. That's not like me at all. Over the past 3 months, there have been more than 100,000 coronavirus deaths in the United States. Public health experts believe that right now, the greatest tool in their arsenal against the pandemic is contact tracing. So what is contact tracing? Basically, it's the process in which health professionals track down everyone an infected person recently came into contact with to prevent them from spreading the virus. You mean like an actual tool? That sounds logical and straightforward. In order to determine how and where the virus is spread. You know who else could use this, or should have used this?
China.
But in all seriousness, let's talk about this logically. In an interview with JAMA in early June, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said that it takes a minimum of 3 weeks for a behavioral change, such as shifting away from social distancing to large mass gatherings, to cause an increase in infection rates. A minimum of 3 weeks to see any reasonable change, huh? Well, let's see. This here's a calendar for the month of June. You see, here we are on 6/25. 3 weeks ago was June 4th. Let's see what happened on June 4th. Los Angeles has lifted its curfew and protesters are peacefully marching through downtown. From CNN. I wonder how LA is doing. Oh no. Look, realistically, I know correlation does not imply causation, but I have a hard time believing that this coincidence, being so prevalent, so obvious, so logical, that it isn't being considered. Actually, it's worse. It's actively being suppressed. Remember, NYC's contact tracers are asked not to ask others about protest activity. Asking about protests hurts the fight against COVID. The media is lying. The real problem is, many people will not be able to tell what's real anymore. That's all I have for you. Thanks everyone for joining me tonight. I hope to see you on the live stream on the Moisky Live channel tomorrow night. Be sure to like, comment, and subscribe if you haven't already. Thank you all for joining me, and I will see you all soon.